I have made a point of treating a large number of children who've been told they have to have surgery. I treated about 30 patients. I remember I'm not a surgical specialist these days. These people came to me by chance, but every one of them, except one, was successful. They didn't need surgery. When I think of the trauma involved in surgery for young children, well, quite young children and young adults, it's a very traumatic procedure. They saw the lower jaw into 3 bits, and they saw the upper jaw away from the skull, and they don't talk about it much, but occasionally people die. All right, doesn't happen often. It is a very dangerous procedure. And really, if only someone looked at the research, they would see that over half of all jaw surgery relapses afterwards. If they were told that in the first place, which I'm sure they're not, they would never have it. But I sent a list of all those cases, the records, to the English General Dental Council, and they refused to even look at them. In my belief, again, this is not my subject, but I'm a pretty broad thinker. And I feel very certain that very many women these days never develop the right hormones. You can tell this in other ways. There are a large number of very flat-chested women. There are a large number of women who have narrow hips. These are all hormonal factors, remember. And there are quite a large number of women these days who grow hairs on their face. All these are a sign of hormonal disruption. And I think it is disproportionate, mainly because of our unnatural lifestyle. Girls were never intended to enter the world of work.
Right. So at the risk of sounding politically incorrect, Doctor, and I know you're not afraid to go down that road, you've been saying things that people find uncomfortable for your whole life. What does natural life look like then? I think you've just expressed it, but you're saying that women are getting pregnant at too old of an age in their living lifestyles, and men, by the way, men probably are too at this point. They're living lifestyles that do not lead to hormonal expression that accommodates healthy pregnancy.
Yes, I mean, you're absolutely right. A lot of women hate me very virulently simply for saying what I believe is the truth, and they must, in their minds, know that I'm not entirely wrong.
Well, usually when people get defensive, it's because they know that what you're saying, there's a truth to it, right? The truth hurts.
Well, if you know the truth, I think you should tell people, but not everybody agrees with me.
Well, when Jesus told the truth, he got crucified, Doctor, so keep that in mind.
I see myself sometime as John the Baptist, who said nothing and did nothing but good things, told the truth, and had his head chopped off for the trouble.
Yeah, that does seem to be the way it goes in this world, Doctor. So, wow, that's incredible, though, that, to think of how interconnected it all really is, and to think of, to correct the epidemic health issues that we face in our world really requires three-dimensional, holistic sort of rebuilding of culture and of life. Even women at age 18 getting pregnant, that's very rare. Normally, women are getting pregnant now at age 28, 30, 35, 40 even. And so we're not even close, Doctor.
Yes, you can't go against nature for long. I have no doubt that things will change, and I would say most of what I'm saying will be accepted one day. But as you say, there is a huge lobby of people who don't want to accept it, either orthodontists or young ladies.
What do you think about where the future of orthodontics is headed? Are we headed forward or backward?
I think it's staying still.
Yeah, you think that there's some doctors taking steps forward, but then just as many taking steps back, and so we're at sort of an impasse here, where the net result is that the orthodontics is going nowhere?
I think progress is slow. You may not know that the process in orthotropics is to start by putting the upper front teeth in the right position. Now, they should be, with most cases, about 7 or 8 millimeters up and forward from where they are. Therefore, you have to push them there to start with before you can then get the rest of the face to go upwards and forwards. Now, there is a certain amount of risk here, and you need to know what factors to be careful about. And many orthodontists have pushed upper front teeth forward and found that they pushed them out of the bone. I believe you had that problem yourself. And that's because they don't understand how to do it and what precautions to take. And it takes time to learn that. And therefore, I'm sure there are a large number of orthodontists who are slowly moving in that direction as a result of what I've taught them in orthotropics.
I just want to come right out and ask, what do you think about double jaw surgery? Have you ever referred a patient to double jaw surgery?
Absolutely not. I had made a point at one time of treating a large number of children who've been told they have to have surgery. I treated about 30 patients. I remember I'm not a surgical specialist these days. These people came to me by chance, but every one of them, except one, was successful. They didn't need surgery. And when I think of the trauma involved in surgery for young children, well, quite young children and young adults, it's a very traumatic procedure. They saw the lower jaw into 3 bits, and they saw the upper jaw away from the skull, and they don't talk about it much, but occasionally people die. All right, doesn't happen often. It is a very dangerous procedure. And really, if only someone looked at the research, they would see that over half of all jaw surgery relapses afterwards. If they were told that in the first place, which I'm sure they're not, they would never have it. But I sent a list of all those cases, the records, to the English General Dental Council, and they refused to even look at them. I was showing every child how to avoid surgery, and not one of them was able to benefit.
What about adults, doctor, who have really severe sleep apnea?
Well, it depends what I have treated a lot of adults with orthotropics, but you don't get much improvement, certainly not really after the age of 25. Yes, I can get surprising amounts up to 20, really quite big changes. After that, really not much. But if you knew at any age, your face will slowly improve. So incidentally will your general health.
You would never refer an adult, though, to double jaw surgery?
Absolute nonsense.
You think they're better off?
I have to make the exception. Some people can look more attractive by having their bones manipulated and put in different positions. But because it relapses anyway, I think it's not worthwhile.
Sure, sure. What do you think of your son, Dr. Mike Mew, having tried some MSE cases? Have you spoken with him about that?
As many people say to me, Michael uses MSE. He does other things differently from me. But have you ever met a son who does all the things his father suggests?
I'm certainly not one of them. So, is it a point of contention at home?
No. I'm very supportive of him, particularly at the moment. But he thinks MSc is okay. I think partly, as you did, he said it works. And I'm looking at the damage it does, rather than just the benefits it has.
Right. What advice have you given Mike about his situation? How have you coached him through it? How have you given him fatherly advice?
I've sent him a lot of cases and records showing that orthotropics is better than orthodontics. But of course, we're dealing, or will be dealing, with a trial which is full of people who radically disbelieve us in the first place. And therefore, I don't think there's any way we can win.
What spiritual advice have you given him in terms of what spiritual or emotional advice have you given him?
Well, as much as I can. I mean, I'm his father, and I still love him dearly. But he really is very depressed at the moment, and I really worry. He's, completely off work. He's off most things, and it's terrible. Yeah. I think they're destroying his life, and he'll never be repaid for that.
Well, let's hope he comes out the other side, Doctor. I mean, maybe when this is all over, he'll rise up out of the ashes. It breaks my heart to hear that he's having such a hard time emotionally with it. Do you think that his constitution is not like yours when it comes to dealing with this type of criticism?
I think I'm probably such a tough old bird that it'll take a lot to destroy me. I mean, to be discredited by your friends and colleagues, to have your license removed because your treatment is so bad, it is very demoralizing. But there we are. One day the truth will out.
I predict that 100 years from now, people will look back at Dr. Mew the way we look back now at Galileo or Copernicus or any of these other scientists who were scolded in their time, burnt at the stake, excommunicated, but posterity looks back and says, how could they have been ridiculed when what they taught was really so obvious and so brilliant?
Well, that's a lovely note to finish on, Ron. I can only hope that something like that will happen. I'm sure that orthotropics will be accepted.
Let me help you. Let me guide you through your own jaw hacks journey, whether it be involving MSE, double jaw surgery, or whatever's best for your airway, your jaws, and your needs, even if that just means coaching with regards to lifestyle stuff, training, diet, whatever it is. I can share the insights that I've gleaned on my journey the hard way so that you can cut right to the chase, skip all of the hard lessons that I've had to learn. Just take the warrior knowledge that I've accumulated over the past 12 years of hardcore fitness hacking and 6 years of being in orthodontics. Let me help you. Sign up for a one-on-one chat. They're going to go through January. Come February 1st, chats are done because that's when I start my 3 months in my seasonal job as a tax preparer. So if you're interested in chatting, now is the time. You can sign up at jawhacks.com/chats, link in the description, and I look forward to chatting with you and helping you rise out of the ashes and grow up and out of your little Jimmy situation. All right. Peace.